Night Africa Live.
Boogie woogie. And when we jam,
Chat Night Africa Live, straight talk on matters
it's all right
that
here.
you care about.
It's dynamite.
Chat Night Africa Live from Washington, D.C. metropolitan area.
I'm coming back.
I'm coming back.
I'm coming back.
Right now, I am with you for something volcanic. Volcanic. It's going to touch you in very different ways.
We're gonna get down.
You don't want to miss this edition.
We're gonna dance. We're gonna dance. We're gonna dance.
Chat Night Africa Live today.
I'm coming.
We originating from the metropolitan area of Washington,
We're gonna dance.
D.C.
We're gonna dance. I'm ready. I'm coming. I'm dancing. I'm dancing.
And my guest on Chat Night Africa today is one of the best cardiologists in the United States. Dr. Aggie Eno will be connecting remotely live from Wisconsin in the United States.
It's all right here. It's dynamite. I'm ready. I'm coming.
This is Chat Night Africa.
I'm ready to get down. I'm ready. I'm coming. I'm dancing. I'm dancing. I'm ready. I'm coming. We're gonna dance. We're gonna dance. I'm coming back.
I'm coming back.
I'm coming back.
Right now.
I'm coming.
Right now.
We're coming to get down.
This is Chat Night Africa Live.
I'm coming to dance. We're gonna 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 get down. We're gonna get down. We party hard. We boogie. We boogie.
Invite your friends to share this video because we will be talking about the engine of your body, your heart.
It's dynamite. I'm ready. I'm coming. I'm coming back. I'm coming back. We're gonna get down. We're gonna get down. We're gonna dance. We're gonna dance. I'm coming to get down. To get down. We're gonna dance. We're gonna dance. I'm ready. I'm coming. I'm coming to dance. To dance. We're gonna dance. We're gonna dance. We're gonna dance.
Hello, everyone, and welcome to this week's edition of Chat Night Africa Live. In this broadcast, we'll be talking about matters that matter, and your heart definitely matters to you. Your heart is the engine of your body. Ignore your heart, and a heart attack might just be seconds away. So, what are those cardiovascular diseases? These problems and more. Dr. Ajay will be connecting from the state of Wisconsin, and we will be asking him some very important questions. This is Chat Night Africa Live, and in just a moment, again, we'll be talking to Dr. Aggie. Dr. Aggie Enoch is our specialist this evening who will be taking some very important questions from my end this evening. And before we get to connect with Dr. Aggie, let me introduce him a little bit so that you know why he is here and why he's qualified to talk about this. Dr. Aggie Eno is an interventional cardiologist. He has been a clinical instructor at Rush University Medical College. It looks like Dr. Aggie is on the line. Let me get him right now, and then we will continue to introduce him. And he has so much information for you. Share this video because it could be life-saving. It could be life-saving for many, many people. Dr. Aggie will soon appear on my screen. Hello, Doc. You have to probably adjust your camera because, yeah, you are sitting because we're seeing only your nose down. All right, you're fine. You're fine. Hello, Doc. Thank you for joining us this evening. This is Chat Night Africa Live.
Thank you for having me.
Thank you, sir. How is Wisconsin today?
Well, the weather is in the 30s, so it's still a chilly spring out here, but otherwise things are pretty good.
Well, Dr. Aggie, the reason why I bring you on the show today is because in many parts of the world, people still think and believe witchcraft. When somebody dies of heart attack, what goes around the village is that somebody bewitched him. And because of that, all kinds of things go wrong. Families fall apart. I mean, all kinds of things go wrong. Very few people believe or understand that you can go to bed now feeling healthy, talking with people, and simply don't get up the next morning. Now, the first question I want to ask you, Dr. Aggie, is we hear of heart attack, we hear of cardiac arrest, heart failure. Do all these things mean the same thing?
No, they do not. But you know, they are sort of interrelated. I will start with heart attack. Now, the medical definition of a heart attack is a blockage or a blood clot within an artery that supplies blood to the heart muscle. So the heart is a muscle like any other muscle in the body, and it needs blood to function. So it has arteries that supply it with blood. And if you develop a sudden blockage of one of those arteries, then you develop a heart attack. So that's the definition of a heart attack. And I'll move into the definition of heart failure. Heart failure, on the other hand, is an inability of the heart to pump enough blood to meet the body's demands for blood and oxygen.
Right. And how about cardiac arrest?
Now, cardiac arrest, simply put, the heart is both a pump and it's also an electrical organ. And in cardiac arrest, the electricity fails and the pump stops working. So that is cardiac arrest. And cardiac arrest can be caused by a heart attack or can be caused by heart failure.
Why should anybody really pay attention to all this? I'd like you to tell us a little bit about the depth and scope of either heart attack, cardiac arrest, or heart failure.
Yes. So heart attacks and basically cardiovascular disease is the leading cause of death worldwide, together with cerebrovascular disease. But heart disease is the leading cause of death worldwide. A little more so, just a little more so in developed countries, but in developing countries, there is a rise in heart disease as well. With the rising waves of obesity, with people with life expectancy being longer, people living longer, increase in risk factors like smoking, inactivity, the rates of heart-related deaths has increased and continues to rise.
Now, you talk about increased inactivity, and you doctors say we should exercise. What confuses a lot of people is, I mean, nobody can exercise better than Captain Song Bahana, who captained the Indomitable Lions of Cameroon for about 10 years.
Yes.
We had Marc-Vivien Foé, who was one of the best midfielders Africa has ever known.
Correct.
We heard about, he dropped off his feet and died. I mean, I was watching the game. We heard about Samuel Okwaraji of Nigeria, Green Eagles, when the Green Eagles were really Green Eagles, in the days of Peter Rufai, JJ Okocha, and so on. This guy also dropped off his feet and died. We heard about Fabrice Ndala Mwamba, who played for England. Fortunately, he survived it. Song Bahanak survived it, but it was going to be disastrous. These are guys who exercise like monsters. So how would you convince somebody here that inactivity would lead to heart attack? when these guys are active all the time?
Yes. So a lot of what you describe, I will call cardiac arrest and not heart attack. So the medical definition of those would be cardiac arrest and not heart attack. And remember, I said cardiac arrest is there's a failure in the electricity and a failure in the pump function of the heart. So the heart basically stops working. And heart attack is a blood clot in an artery that supplies blood to the heart muscle. So, and these when you have cardiac arrest as an athlete, it's usually due to a heart muscle problem and not necessarily a heart attack. A lot of those run in families. So I'm sure if you go back in, either McVivian Foey's family, you might find a history of, a heart muscle problem, and that's slightly different from, from heart attack. So heart attack is prevented by increased activity, but what McVivian Foey had, he actually needed to be screened for a heart muscle problem, and certain precautions taken to prevent his own event. So the summary is that activity does prevent heart attacks.
Now, I'd like you to talk about the risk factors in each case. I know you've mentioned a few like obesity, smoking, inactivity. I'd like you to take each component of the heart problem, whether it be heart failure, cardiac arrest, or heart attack. Tell us what the risk factors are in each of these cases. Okay.
So I'm going to start with heart attack, which stems from coronary artery disease. Coronary artery disease results from a buildup of cholesterol, cholesterol and fat in the heart arteries over time. And a heart attack happens suddenly when some of that cholesterol that built up in the artery is exposed to the bloodstream and the blood clot forms. So inactivity, being overweight, cigarette smoking, diabetes, stress, the male sex, postmenopausal women, or just getting older. These are all risk factors for buildup of cholesterol in your heart arteries. Now, heart attack can lead to heart failure, because when you have a heart attack or there's a blockage, in an artery that supplies blood to the muscle becomes weak and can no longer perform its pump function. And who talks about a weak heart muscle talks about heart failure. Then you start having trouble, you start having more shortness of breath with trying to be active. And so the same risk factors for coronary disease can eventually lead to heart failure. Add to those risk factors hypertension. I may not have mentioned hypertension. So both heart attack and heart failure have similar risk factors. And how both heart attack and heart failure kill you is you suffer from a cardiac arrest. When both conditions have progressed, then you have a failure of the pump and the electrical function, and your heart stops beating, and that's what causes a sudden death.
This is scary. Doctor, I'm going to ask you some crazy question. When you know about this, do you go to bed and really sleep? I just thought I should interject with this.
Yes. Everyone out there should be aware of what their cholesterol levels are. Everyone out there should be aware if they have diabetes, if they have a family history of heart disease. Once you get to be middle-aged, I would say, and probably even before, I would advise everyone to visit with a doctor so that they check for and control all your risk factors. Knowing that you don't have any risk factors, or that these risk factors are under control, would be a way to sleep better at night.
let's talk a little bit about stress. Usually when parents get exasperated or wives get exasperated or the husband's getting fed up with the wife, say, when I go give me a heart attack for this house. Can 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 human relationships be a cause for heart attack? Either because you're having difficulty in your marriage or with your children? Could that lead to heart problems and definitely death?
Yeah, absolutely.
How so?
One of the leading causes of heart attack in the West, I would say, is stress, because studies have been done where if you look at a community, two communities, in one community, people do not necessarily have a good diet, but they live in they live in a nice community. They are surrounded by family. They meet for family dinners. They have better relationships. And there's another community where people are isolated, work long hours, are under a lot more stress. And the amount of heart disease in the community where people are more isolated and have more stress, the amount of heart disease is elevated. So something about stress increases inflammation in the body that causes a whole host of diseases, including coronary disease. So the answer to your question is that yes, a lot of stress at home, between
Spouses,
family members, spouses, can also
children, and parents, and so on.
Can increase heart disease.
Dr. Ivo Dita just posted a question. I'll take the question to you, and please invite your friends to ask questions. Any question that you post, I will relay the question to Dr. Aggie Enoch.
Yes.
I'm going to take you to some news event in Cameroon, somewhere in the French-speaking area, where an administrator took a young woman into a hotel, and I think after sexual intercourse, this guy was found dead. How is sexual intercourse related to heart attack or heart failure or whatever you call it?
Yes. So
how could he have?
Yes. So here's what I would suspect. A middle-aged or elderly gentleman probably has some underlying heart blockages, I would say. So there's been buildup of cholesterol in his heart arteries over time. And during sexual intercourse, your heart rate, and the workload of the heart increases significantly, and that can whatever area of poor blood flow you had would be made worse when the heart is under a lot of stress, when the workload of the heart is increased. So basically, during sexual activity, the heart needs more blood and oxygen. But if you have heart blockages, the heart cannot get that amount of blood and oxygen. And so the heart becomes distressed, and you may develop an irregular heart rhythm, and the heart may fail.
We have seen people, both the young and the old, taking, the sexual or enhancement meds, Viagra, and many other Cialis and so on. Before we talk about cholesterol, would you advise somebody to take those for whatever reason, given that it could lead you to overworking yourself?
It is okay for any healthy individual, and that's why I encourage everyone, yourself, myself included, to follow up regularly with a primary care doctor to be able to identify any heart disease. Now, for any healthy individual who doesn't have underlying heart disease, there's no problem with taking drugs for erectile dysfunction or sexual enhancing drugs. There is no contraindication to those. However, for patients with heart disease who may be on certain heart medications, I would advise that they check with their doctors before taking those kinds of medications.
Well, guys, I think it's for a reason that God made it that when you get into sexual activity, at some point you have to rest. If you push yourself a little bit too hard, you could be looking for trouble for yourself. It looks like, because then you're overworking yourself without rest. Now let's talk about blood clot. I've heard about blood clot a lot, and cholesterol. What are the things that we do that build up cholesterol in our arteries that could lead to rupture or all those things that,
Correct. Yes. So diet is very important, and the diets that are recommended to lower cholesterol levels are diets that are more plant-based than animal-based. Diets that are low in saturated fats, and those saturated fats are things like palm oil has a lot of saturated fats. I think even coconut oil has a lot of saturated fats. So going for oils that don't have a lot of saturated fats in them, things like olive oil, or there's a lot of commercial oils that are low cholesterol oils. I would also recommend staying away from a lot of starchy foods. So lowering the amount of starch in our diets would lower our cholesterol levels. Now, starchy foods are almost everything we eat: bread, rice, yams, cassava, gari, potatoes. So lowering the amount of starchy foods in our diet. Sugars are also they also lead to increase in the levels of cholesterol. So a diet high in fiber. Fiber would be, spinach and plant-based foods. A diet that is, in terms of protein, proteins like chicken and fish are preferred to red meats. And fruits. So fruits are also overall good for for helping to lower cholesterol levels. So I talked about diet. Physical activity, 3 to 4 times a week is recommended for at least 30 to 45 minutes at each session of physical activity. Obviously, keeping a lean body weight. So what we call, quote unquote, abdominal obesity. So having a lot of fat around the belly doesn't help with cholesterol levels as well.
Now, you talk about physical activity. Most times, especially in the West, and even now in many African cities, people go to the gym. Somebody who has never been to the gym and just about to start activity in the gym, what do you advise them to do? Jump on the treadmill and start jumping, going hard. What do you advise them to do?
Yes.
Somebody wants to do physical exercises.
Yes, I would advise. That's a very good question. I would advise to start with a quick walk at an incline, and you could start that on your. If you're new to activity, I would start that on on my first week, just a walk at an incline, and then over time that could be increased to to running, and as your endurance permits, you can increase that to a mile or 2 miles or 3 miles. Even up to 5 miles per activity session. Lifting weights is also helpful. You could start with light weights and go to things that are a little heavier. That helps with it helps with heart health, but also with bone health.
When I go to buy stuff, I like reading labels. You see sodium, you see sugars, you have all these sodas, sweet drinks all over the place. Is sodium the same as salt?
In my world, yes, because we the recommendation is to consume less than 2,000 milligrams of sodium a day, and you can every time you look at a bottle, or a package from the grocery store, you can add that up to see, to make sure it amounts to less than 2,000 milligrams of salt a day. Low salt helps control the blood pressure. And this also helps, who says low blood pressure says decreased risk of heart attack and heart disease.
Now, when you talk about salt / sodium, you realize that these things are in the breads we eat, virtually everything. I mean, the sweet drinks. What should we do? I want to make sure, are we also meaning the salt in our shakers and on the salt that we cook with?
Yes.
Or these hidden salts in bread, in cakes, in sweet drinks, and just about anything, sardines, everything around you is with sodium, and so much sodium.
Yes. So the recommendation of 2,000 milligrams of sodium in a day is for all all foods, whether salt that you add to your food or whatever is already in the food that you eat. One way of lowering salt intake is really by preparing your own food from fresh produce from the grocery store, and avoiding food in cans or processed food. That is a very good way to avoid or to respect a certain level of sodium in our diet. So if you got fresh produce each time and limited the canned food and the sardines and I don't know, and the salty chips, that's a good way to lower your daily salt intake.
Let's go to Dr. Ivo Dita's question. And please, if you have any questions related to cardiovascular or heart problems or your heart health, this is the time for you to ask this smart guy connecting with me from the state of Wisconsin. Dr. Dita wants to know if there are some factors unique to there's risk factors unique to Africans or African Americans.
So Africans and African Americans, they tend to have something about the African genetics makes us more prone to retaining salt. And if I go back in history and see that we grew up in hotter climates, or we for the most part were in hotter climates, then our bodies over time have gotten used to retaining salt, because when you retain salt, you retain water. And so that may have been an adaptive mechanism over time for the body to retain salt and water to fight hot climates and prevent dehydration. So as a result, African Americans and Africans are more prone to hypertension. That's one thing. They're also more prone, to obesity. Now, I think hypertension and obesity are some of the risk factors that are very common in Africans and African Americans. The other thing that is very particular to the developing or to the developed world is that there's areas where there's no access to fresh produce from the grocery stores, and a lot of the food that we eat that is eaten in those areas are fast foods, which are very high in in saturated fats and cholesterol and those things that are very bad for the arteries.
Another question, this time from Dr. Dita. I got your other question. I will be. Thank you so much. Dr. Dita I'm almost at the point of calling him Chat Night Africa Live Doctor. Thank you so much. Thank you so much. Dr. Dita is asking if routine screening, that is, you go to the hospital, you ask your doctor to do routine screening for heart diseases, whether it's recommended. But before you answer that, I got a question from Ernestine Milo. What are the symptoms of heart diseases?
So the symptoms of heart disease are Inability, so shortness of breath, fatigue. So for instance, a month ago, I could go up 2 flights of stairs without stopping. But now I notice that after going up a flight of stairs, I can hardly catch my breath, and I have to stop halfway. That would be something to suggest underlying heart disease. Chest pain, heartburn that occur with exertion. So going up a flight of stairs, or lifting some groceries, or a bunch of plantains wherever you live, and experiencing central chest pain that usually radiates to your left shoulder or to your jaw, and that is relieved by resting for a couple of seconds to a minute. Those are very typical of heart disease. Other things that could suggest heart disease: shortness of breath with laying down at night. So if grandmom goes to bed and she cannot lay down in bed but has to sleep sitting up in a chair, that could be a sign of heart disease. If she wakes up in the middle of the night saying that she has trouble catching her breath, that's also a sign of heart disease. Lower extremity swelling, swelling in the legs or ankles could also be a sign of heart disease. Sudden passing out, sudden loss of consciousness, especially maybe during activity, whatever the activity may be. So the real summary is that most symptoms of heart disease occur with activity. So if you notice that, with activity, you get more shortness of breath, chest pain, those will be signs of heart disease.
A question from Mabel Tuma. What are the particular implications of heavy abdominal fat as it relates to heart disease? Part B of her question: how does smoking increase your chances of heart disease?
So now, abdominal fat would increase, it would increase your, it will make you more resistant to insulin. So basically, with abdominal fat, there's probably a lot more sugar that stays in your blood as opposed to being taken into the cells, and a lot of that extra sugar would be converted into cholesterol and fats, and those can be deposited in the arteries. So that's one. Diabetes is also something that could result from a lot of abdominal fat, and abdominal fat in itself is a risk factor, for heart disease. Smoking causes hardening of the arteries. That's really the simple fact. So with smoking, the arteries are, they're a little more, they can get a little more hard or calcified over time. The other thing is that smoking causes a little more inflammation. It can cause inflammation in the inner lining of the vessel, that can lead to heart attack. Quitting smoking at whatever age, so every day or week, after having quit smoking, your risk of heart attack or heart disease goes down. So that's an encouragement to people out there who are still smoking. They should know that it's never too late to quit, because your risk goes down with every day or month, after which you have quit smoking.
If you have questions, anything related to heart health, the functioning of your heart, please post the question now, and I will get the questions over to Wisconsin, where my guest, Dr. Aggie Eno, is talking with me on Chat Night Africa Live this day. Now, you talked about blood clot. Let's talk a little bit, because many people die and we hear they say blood clot. Again, explain what, and lately we've had so many in our community.
Yes.
Tell us a little bit about blood clot as related to death, heart attacks, and whatever goes wrong with your heart.
Yes. So a lot of times in the community, when you hear someone had or died of a blood clot, they are most often referring to a pulmonary embolism or a blood clot in the lungs. And basically, the risk factors for this are, being sedentary, being overweight, smoking, being on oral contraceptive pills, or um, uh, there's one more risk factor I'm missing. Having had recent surgery would also be a risk factor for blood clots. Some people's blood is also just a little sticky as a result of a hereditary condition that they have. Now, it starts with a blood clot that forms. So a blood clot is basically how do I describe? It's when blood forms a little mesh, or it turns solid because it's been stagnating in a vessel. It forms a little mesh ball either in the leg or in the pelvic area, and that mesh ball travels up into the lungs and is lodged in the lungs, and causes shortness of breath and causes people to pass out. It can cause sudden death because if the clot is very big, then it can obstruct blood from flowing through the lungs. So that
Now,
is what
yeah. Go ahead, sir. Go ahead.
that is what people usually refer to when they talk about a blood clot. It's a blood clot going to the lungs.
I'm sure that somebody must be wanting to ask a question. Should you therefore take aspirin to avoid blood clot?
That's a very good question, and indeed, there's been a recent article, and it's on the news, discouraging, people from taking aspirin. The clarification I
followed that story.
Yeah, the clarification I would make is that if you are a healthy individual out there who has, seen a doctor and you have no risk factors, and you choose to take an aspirin just to prevent something bad from happening, then aspirin is no longer recommended for you. However, in patients who have underlying heart disease, known heart disease, who may have had heart surgery, or who have stents put in their heart, such patients still need to be on a baby aspirin. Patients who have had prior strokes, also still need to be on a baby aspirin. So if you are healthy, otherwise healthy, without any risk factors, there's no need to take aspirin to try to prevent something bad from happening.
Now, let me follow up on the issue of blood clot, especially when somebody has surgery. I mean, I had surgery, 2 major surgeries in 2016 within a week. Mm-hmm. And I heard about these things so much about blood clot. What happens if somebody has surgery and then blood clot resolves? What happens?
Yes, that's a very good question, Mr. Chiamaka. Surgery, when you have surgery, they cut through a lot of tissue and through a lot of blood vessels in your body. So the body is it's in a clotting state, or it's trying to stop bleeding, and so the body is in a little bit of a we call it hypercoagulable state. That in addition to the fact that after surgery most people are sedentary. So after surgery, you'll be convalescing at home, maybe mostly laying in bed. Now, as blood stagnates in the veins of the leg, or at the site of where you had surgery, think of someone who had belly surgery. As blood stagnates in those areas, wherever blood stagnates, it's likely to form little clots. And those clots can travel back up to the heart and lungs and cause disaster. So for those who have had surgery, the recommendation really is to try to start walking as quickly as possible. And for those who cannot walk early after surgery, sometimes a low dose of a blood thinner to decrease the risk of blood clots is advisable. And that would usually be recommended by your doctor based on the kind of surgery.
And if you're boarding a flight for about 15 hours, you're going to be sitting on the plane. Should you take some aspirin before going to catch a flight? Especially if you're flying from here to Africa, or like one time I flew to Indonesia, I was on the flight for about 20-something hours from Cameroon to Indonesia. Should somebody take aspirin if you're going on a long flight?
while there are definitely there's probably articles out there that talk about taking high doses of aspirin to prevent blood clots, deep venous thrombosis or blood clots. My recommendation to anyone without a history of blood clots would be to stand up and go to the bathroom as often as you can. So within every hour or two, I would stand up and walk around, because as you move your muscles, you decrease that risk of clots forming in your legs. Now, for people with a history of blood clots, especially those that occurred in while they were sedentary, there could be a strong consideration to speak to your doctor about whether taking a blood thinner will be advisable for the period of for that period that you'll be sedentary.
I have a question from Ernestine Milo, and please, if you're watching, those of you watching, share this video, invite your friends, post questions like other people are doing. Ernestine Milo wants to know whether swollen legs, let's say you are sitting for 6 hours and resting, and then you find your legs swollen, could that be a symptom of heart disease? I think I get Ernestine's question. I guess that's the question.
Yes. So that's a very good question, Ernestine. So yes and no. So the most common cause of getting swelling in your legs after sitting for a long time is just what we call venous stasis, or leaky veins in the legs. Some people, as a result of genetics, as a result of body habitus, or as a result of just getting older, the veins in the body start to become leaky, and so they can no longer, the valves in the veins have some valves that prevent blood from pooling in our legs. And sometimes those valves no longer perform their function, and the blood tends to pool in our legs. Once blood pools in your legs, then you tend to get more swelling in your legs. So that's the most common cause of swelling in the legs from either sitting for too long or standing for too long. And that swelling would usually go away after a night's rest, or after raising your legs up at night. There are other people who have heart disease who get swelling in their legs. And again, that will be associated with weight gain over short periods of time. It will also be associated with more shortness of breath with activity. So those would be things that, in my mind, that would differentiate heart disease from just venous stasis or benign swelling in the legs.
Question from Dr. Ivo Dieter. What are bystanders to do? And I mean, apart from call 911, we're even talking about 911 because we're in the United States, or I don't know, Gael in Britain in an emergency. What do people do? Gael is watching from Tanzania. She just sent me. I know she lives in Britain. She works in Britain. But the people are watching this program from different African cities and villages. As you're talking, there's no 911. If somebody realizes that something is happening, it's about to happen, because heart attacks strike sometimes like lightning. What do bystanders do? That's essentially the question that Dr. Dieter is asking.
Dr. Dieter, I think that is a very important question, and I'm happy you asked. And it's very important for our viewers to know this. When somebody collapses near you, or you witness a collapse, you are that individual's best chance of survival. Because after 5 to 10 minutes of doing nothing, that may be the end of that person's life. So if you notice someone collapse and you witness someone collapse in front of you, the first thing you do before running to call for help, because every second counts. The first thing you do is you walk up to the loved one or this individual, and you just shake him once, twice to see if he's responding. And if he's not responding, the first thing you do is you start chest compressions. And there's a lot of videos either online to show how to do appropriate chest compressions. But you basically start thumping on their chest, with your palms, as quickly, there's different, there's different rhythms out there. But you pump on their chest, hard and quick to try to keep their heart pumping. And while doing that, then you can ask anybody around there to go and get help. So that's what I'll recommend, because every second that we do not act when someone collapses is maybe a second too late. Because after 5 or 10 minutes of someone collapsing with no one attending to them, a lot of times we are too late to save that life.
I read from somewhere, Dr. Eno, that worry is like sitting in a rocking chair all day, and by evening you get nowhere. People worry a lot because of stress. Some sources of stress could be because of debt. Debt people borrowing more than they can pay back. What's your advice on this as related to heart attacks?
Yes. Well,
say that. I mean, I cannot drive a Mercedes 500, but in the United States, I can go get this thing hoping that I pay every month. And then at some point, you're driving that car and you are extremely unhappy inside because you cannot pay for it, or you go get a house, a mortgage on a house that you cannot pay. I'd like your comment on this: worry, stress, and heart attack.
Yes. So worry and stress, they definitely increase cardiovascular risk and risk of heart attack. And something about the state of worry, just increases inflammation. And I would my advice to everyone is that stay away from things that would make your life stressful, whether it's too much debt, a huge mortgage you cannot afford, or whether it's relationships that are not edifying, because every stressful situation is not good for heart health, for autoimmune health even. It's just not good for the body overall.
Gael, Bridget, talking from sending a contribution from Tanzania, says you're driving that big car, but you are hallucinating inside because you're wondering where the next payment is coming from. Thank you, Gael. I have a question from a viewer. Is drinking a lot of water, recommended for people with heart diseases?
That's a very good question. So I'll answer that in 2 steps. So water for overall health, heart health, is good. And this is not for the individual who has advanced heart disease. So if you do not have heart disease, the more water you drink, that's space in your body that could be replaced by soda, by carbs or bread. And so the advice for people who are trying to cut back on the amount of calories that they eat is to always drink more water, because when you drink more water, you tend to be less hungry. Sometimes we confuse hunger and thirst, and we tend to eat more when we're thirsty. So drinking more water for heart health, kidney health, and for weight, and it's good. Now, for people with heart failure or weakened heart, there may be limits to the amount of water you can drink in a day, because when you have advanced heart disease, the heart may not be able to handle all that water volume because the pump is weak, and so all that water that you drink may back up and cause swelling in the legs, or water filling up in the lungs. So you may have a loved one out there who has been told by their doctor to limit the amount of water that they are drinking, and that would be the kind of situation where limiting water would be helpful. But for the person who is trying to stay healthy, water is very good.
Well, I have a question. Chest compressions are started when a person has no pulse. What does a bystander do to a person complaining of chest pain but has pulse? Is aspirin recommended in such a circumstance? That's a question that just came in. Now we are, in case just joined this broadcast, the topic for today is cardiovascular diseases, heart health, heart attack, heart failures, all kinds of issues related to your heart not functioning, or that could lead to death. So if you have any questions, please post them right now and the doctor will answer. Yes, doctor, what's your answer, please?
Sorry, can you repeat your question again, please?
She says chest compressions started when a person has no pulse. What does a bystander do to somebody who has chest pain but has a pulse?
Yes.
And the question continues: is aspirin recommended in this kind of in such a circumstance?
Yes, absolutely. Aspirin, a full strength aspirin would be recommended in someone who develops, a sudden onset of crushing, chest pain, and the person can chew either 4 baby aspirins or just a full strength aspirin. The next thing I would recommend is nitroglycerin. Some people carry nitroglycerin around, which is a little tablet that you can put under your tongue if you're having chest pain. The recommendation is to place 1 tablet underneath your tongue and wait 5 minutes to see if this pain resolves. And if it doesn't resolve, you place a 2nd tablet under your tongue after 5 minutes and then call 911. Now the bystander, can if the pain doesn't resolve after taking the 4 baby aspirins, can help to drive this person to the hospital. Because the last thing you should do is try to drive yourself to the hospital when you have chest pain.
This is Chat Night Africa Live, and if you have it, we're making this very interactive, so please ask your questions. And as you must have realized, Dr. Eno will answer them. Let's talk about diabetes and high blood pressure. And that's very, very important because a lot of Africans, especially, a lot of people, not only Africans, they go around with high blood pressure or diabetes without knowing, because there's really nothing to show outwardly that you have that condition. How is diabetes or blood pressure related to any of these heart conditions that could lead to death?
Yes. So high blood pressure accelerates formation of a buildup of cholesterol within the arteries. If you think about it, the more pressure, the more pressure that's within the arteries, the more you can call it, small injuries to the wall of the artery by the high blood pressure, and as a result, you can start to form or build up cholesterol within the arteries. That's the same with diabetes. Anyone who says diabetes just says that the small arteries of your heart or the small arteries of the body, they all start to develop little layers of cholesterol in them. So how to screen for high blood pressure. The first thing I would let everyone out there know is you should know if you have a family history of high blood pressure, because if you have a family history, then you are more likely to develop high blood pressure in your lifetime. And I would, if you have a family history, I would make sure I own a blood pressure cuff so that I take my blood pressure, from time to time, or have it taken, by a friend, or, going to the hospital and just have your blood pressure taken. And for diabetes, if you have a family history of diabetes, you should also get screened for diabetes. And if you don't have a family history, at least, I would say every few years you should get blood drawn to make sure you do not have high blood sugars.
Take somebody who has diabetes or who has high blood pressure, and they are taking their medications as recommended. Is that person still exposed to heart attack or any of the heart conditions?
They are still at higher risk than someone without diabetes or without hypertension. But taking your medications definitely significantly reduces your risk. Probably close to what that of the general population or those without these conditions. But I would say you're not your risk is slightly higher than someone without those diagnoses.
You explained earlier, Dr. Eno, that heart failure is when the heart doesn't pump enough blood. What leads to that? Why shouldn't the heart pump enough blood when the heart is meant to pump blood?
So heart failure. So the heart is a muscle. The heart is, the heart is an electrical organ, and the heart is also, it also it also gets blood supply to that muscle. Now, think about. Let me repeat that again. So the heart is a muscle. The heart is an electrical, it's an electrical organ, and the heart, on the inside of the heart, you have these valves or these doors that function to let blood in and out. Okay, so the heart failure can result either because the muscle gets too weak, and the muscle can get weak because you're not getting any more blood flow to your heart. Maybe all the arteries that supply blood to the heart are blocked by cholesterol. That can cause heart failure. If the muscle gets weakened because of either a family history of a weak heart muscle, or maybe a familial muscle condition, or maybe long-standing high blood pressure, that can also cause heart failure. Now, some people develop disease in those valves or those doors within the heart muscle. So if some of these valves are not working well to let blood in and out of the heart, you could also develop heart failure. And all these different things, can be diagnosed and treated, by your cardiologist. The way to identify heart failure, again, is increased swelling in your body, shortness of breath with activity, shortness of breath when we lay down at night, or an inability to lay flat in bed. So those are, that's basically what could cause heart failure, and that's how to identify it.
Doctor, I know of a woman, a mother, who sat by the firesides with her family members, and around 10 o'clock, she said, "Hey, you guys go sleep, let me go sleep also." She went to bed and just slept in the same position, did not move. In the morning, she was found dead. What are the likely scenarios for that to happen?
That's a very good question.
Sometimes, when you see these things happening, you just worry whether going to bed now, as we're talking, Divine might not be up in the morning tomorrow. We don't wish it, but it does happen. If it happened to another person, then it can happen to just about anyone. This woman wasn't complaining about anything when she went to bed.
Yes. So heart disease is a very common cause of sudden death. Sudden death usually results from one of two things. It's either an irregular heart rhythm. So remember, I said the heart is an electrical organ, and every once in a while that electricity, to say it simply, gets out of whack, and the heart starts to fibrillate, or to beat at a very fast rate. The things that cause that, it could either be hereditary, and if it's hereditary, you will have a family history of others who went to bed and suddenly didn't wake up, or it could be as a result of underlying heart disease. Maybe you've had prior heart attacks that you survived, or maybe the heart muscle, the pump is very weak. So all these things could result in you going to bed and not waking up. So to summarize what I said, find out from your family. For those of you out there, find out from your parents if there's any history of sudden cardiac death. That's the first way to screen for this. Number two, have you ever had a heart attack before in your life? Number three, do you have any symptoms that suggest that your heart may be failing? You know, maybe being more short of breath, getting chest pain. Those are things that will, you know, may give you a clue or hints that, you know, that you could go to bed and not wake up in the morning.
I also know of a woman who lived with her son, nurse in Maryland. This mom has her room, went to ease herself, got up in the middle of the night to go ease herself, and just dropped. The son did not know what was happening until he got up the next morning trying to go to work, called mom to say, Mom, I'm going to work. Mom wasn't answering. And then he went to mom's door, opened it, and realized that mom was flat on her face, cold.
Yeah, yeah.
Yeah. In this circumstance, could it be that her heart wasn't pumping enough blood, or there was blockage in the arteries, or what? What are likely scenarios? I know that you have not read the woman's medical report.
Yeah. So all the above. Thank you so much for that question. All the above are likely scenarios. One scenario is that you know, mom had underlying blockages in her heart arteries, and all of a sudden, one of those blockages, you know, became, you know, it became a complete blockage. So maybe there was an 80% blockage somewhere that suddenly went to 100%, and there was no flow, and you know, and her heart suddenly stopped. Another scenario could be that, you know, mom had a weak heart from years of you know, of heart disease, and her heart muscle was weak, and she suddenly developed an irregular you know, heart rhythm. So, and the electricity just started, you know, acting out, and mom dropped dead. You know, other things, you know, there's also things like stroke. Sometimes a massive stroke could also cause people to, you know, to suddenly drop dead. Other situations could be, you know, some people have aneurysms, not only in their brain, but in their, you know, aneurysms in the arteries in their body, which can rupture. The big artery or pipe in the body that carries blood can rupture suddenly if you have an aneurysm, and people can drop dead. Again, the ways to prevent this is screening. You know, everyone needs to see, you know, if you're above a certain age, you need to see a doctor. You know, they need to figure out what your risk factors are. For those who have heart disease, you know, some people need a defibrillator. And a defibrillator is a little device, it looks like a pacemaker, that is implanted under your skin, in your chest wall. And it's supposed to detect the heart failing and to deliver therapy to prevent sudden death. That's not, you know, those are not devices that we are very used to in the developing world. But I think those are a lot more common in the developed world. But defibrillators are also. Yeah,
I have a question from Ernestine Milo. Again, we're getting this very interactive. Ask your questions and I get the questions over. Here's a question from Ernestine Milo. Does sudden coughing and choking during sleep relate with heart disease?
That's a very good question. And it could. It could. In the setting where the sudden coughing in sleep results in you, if you must get out of bed or sit up in bed and sit up for, you know, 10, 15 minutes before going back to bed, and then it happens again several times overnight, where you have to get out of bed and maybe walk around a little before going back to bed, then that would suggest heart disease. On the other hand, if you suddenly cough at night and then you just turn around on the other side and go back to sleep, then that means you just have a little, post-nasal drip, or maybe a little runny nose that's making you cough. So that's another question. That's how to distinguish between heart disease versus not heart disease.
Now, I have a question which I would ask every African to listen to now, because we indulge in that every day when we go to parties. Doc, answer this question. You go to parties, usually we eat late at parties. You have the achu, you have the ndole, you have all kinds of African foods. And then in the cooler, you have cold beer. And it seems when you eat this achu and pour cold beer on it, you feel really good. Now, we're talking about blood clotting in arteries is cold beer on achu soup or some other African food going to get your blood clot?
I don't know
I
if
mean,
I.
I have to admit this. Listen, I love when I eat the big bowl of achu. I love cold beer on it. Now the question is, and keep that aside, when you eat other foods, like say foods that have palm oil, should you be drinking tea because you're worried that maybe it cold water from the fridge could get your blood clot or arteries? Tell us, what should we do? Cold beer and achu soup.
I will have to defer that to the experts on on achu soup and cold beer. But what I would say is everything in moderation is okay. So if you have your achu and a cold beer, once in a while when you're hanging out with friends, then I think that's fine. But I don't think achu soup and beer every night is a good recipe for heart health.
Okay. Now, what therefore? Okay, the body already has or already generates heat for that. Okay, Gael is a nurse in London, so she says the body already generates heat for that because I know Gael eats really good at you. Then London, I see on Facebook. No, sometimes honestly, and this is the thing. Sometimes I go to our African meetings. I want to eat my food. I love African food. And we have all these caps and all that stuff. And then there's the beer in the cooler, the wine cooler right there. I'm wondering what to do, whether to drink wine that is not cold or, so I'm grateful that you made those comments. I'd like you to do a recap of the risk factors when it has to do with heart attack, before we close for the day, heart attack, heart failure, or cardiac arrest. Please,
Yes.
I'd like you to do a recap because some people just joined the broadcast in the middle.
Yes, thank you very much for your question, Mr. Chamakong. So, again, so both heart attack and heart failure are precursors to cardiac arrest. So cardiac arrest is the endpoint of underlying heart disease, and both heart attack and heart failure are types of heart disease. The risk factors are generally very similar. Risk factors would include high blood pressure, which is very common in Africans and African American populations. Obesity, especially abdominal obesity, is a risk factor. Diabetes and kidney disease are also risk factors for heart disease. Other things would be high cholesterol levels. So high cholesterol levels, if certain fractions or certain parts of your cholesterol are elevated, they pose increased risk for heart disease. Other things, inactivity would be a risk factor. Male sex, older male is a risk factor, and postmenopausal females, that's a risk factor. Something about being premenopausal in women seems to be protective against heart disease. So I think that's smoking. I forgot to mention smoking, which is a big one. Those are some of the risk factors for heart failure, heart attack, and cardiac arrest.
And of course, in the course of, earlier in the broadcast, I raised questions why or what led to an administrator with a young woman in the hotel having a heart attack, dying.
Yes.
What were the scenarios? We also talked about it. So please, older men don't want to be a Rambo in this activity, in sexual activity. So you go get Viagra, your heart is weak. And we've discussed that this evening. So, sometimes these things sound funny, like I was talking, I'm laughing, but these are realities we deal with. There's just a certain amount of activity that your heart can take, especially when you are at a certain age. So if you are at 75 and you go get, those enhancement pills because you want to be a King Kong in some activity where you are kind of exposed. I also learned from you today, doctor, that worry, anxiety, these are things, some of the things we can avoid. We can avoid. Do not go get a mortgage on a house you cannot pay conveniently. Do not go get a car because you want to impress people. Do not get a car that you cannot conveniently pay for. And then, like Bridget said, from Tanzania, you're driving that beautiful car, but hallucinating inside. No matter the air conditioning and the good music inside, you are hallucinating. Doc, in the absence of any other question from our viewers, I know this had to be 1 hour, but considering the importance of the heart, which you described as the engine of the body, we went on a little bit above 1 hour. Now, any other thing, last word you want to say to people? I know people want to know what Dr. Eno eats, maybe to prevent heart attack.
Well,
I mean, you're the cardiologist.
Well, as a doctor, I'm not perfect, but I do try to I do try to eat a lot more salads. So when I'm out of the house, at home I eat everything that is cooked at home. But when I'm out of the house and when I cannot control what is going to be put in my food, I generally go for the salad option, which would be low in sodium, low in cholesterol, and high in antioxidants, which is healthy for you. Well, at home I eat the whole gamut, from ndole to eru. Sometimes I chew, but I think I mentioned earlier in the program that living in community and living stress-free is also an important thing to countering heart disease. So, when you go to some of these meetings and you eat your achu and drink a cold beer, the happiness of being there also does something. Yeah, and this is not studied, but it does something to help and protect against heart disease. So
and this, I'm not cutting you, Doc. And I think this is very important. What you say, I really appreciate it, because here, especially in the United States and Europe, we tend to work so hard. And why are we working so hard? Because we borrow things which we cannot afford. And so we have to have 2-3 jobs. So we don't have time for these leisure activities. And as from what you say, this is very important to get the heart muscles relaxed. So folks, relax, relax. 2 jobs, 3 jobs, I can drive you really crazy. And honestly, I see people who are so stressed out. They make a lot of money out of 2-3 jobs, but they have no time for themselves. Yes. They have no time for themselves. So your last word, doctor, before we go. Before you go, excuse me. Before I ask you talk about abdominal fat, and I see a lot of men and women with abdominal fat. Why is abdominal fat, not some other fat on your back, on your arm, the problem? Why would it be a problem?
Yes, the endocrinologists, those who deal with diabetes, have found that when you have more belly fat, you become more resistant to to insulin. And there's, who says being resistant to insulin says there's a little more sugar circulating in your blood. And when you don't get rid of sugars, those sugars are what are converted into fat and into cholesterol and eventually deposited in the arteries. So abdominal fat in itself causes more cholesterol buildup in the arteries and more inflammation in the small arteries over time. So that's what's peculiar to abdominal fat.
And guys, when you go to shop, when I go to do grocery, when I run away from sodas, because the moment I take a bottle of soda, it's sweet in the mouth. It's good to eat chicken and drink this thing, honestly. But then you see, once I look at sodium, which is salt in disguise, then I look at the sugar content, and I'm urging people to look at these things, to pay attention to all these canned foods, the sodium and the sugars that we load in our bodies. They can become a real problem. Doctor, last word.
Yes, my last word is that, heart health is very important. Remember, cardiovascular disease is the leading cause of death around the world. So, take care of your heart, and if you take care of your heart, you're more likely to live, longer, and live a happy life, and enjoy your family.
Well, thank you, Doc. And I will be putting this broadcast a lot on watch parties for more people to follow it. Doctor will be answering your questions. If you forgot any question at all, please, you can ask the question. Doctor will answer. All right? And that's been Chat Night Africa Live. And my name is Divine Chamukonto. Thank you so much, Dr. Eno.
Thank you for having me. Thank you.
And that's how we round up on today's edition of Chat Night Africa. Our topic was cardiovascular diseases. Why do people die in their sleep? Why do people drop off their feet and all those things? What happened that blood clot kills you? We discussed all of that. So share this video and save somebody. Thank you, Doctor.
Thank you. Thank you very much.
Thank you, sir.
We're gonna get down. We're gonna get down. We're gonna dance. We're gonna dance.
That has been Chat Night Africa Live.
I'm coming.
I will come back again.
We're gonna dance.
Exhilarating show.
I'm ready. I'm coming.
I will come back again.
I'm dancing.
Yes.
I'm dancing. We're gonna dance. We're gonna dance.
On Chat Night Africa, we come to talk about the things that matter to you. John Tanto Matchfire and Manon Wayindi,
Boogie
our
woogie.
technicians.
We're gonna jam side to side. This song right here.
And if you feel that you have something important that you can share to other people via this platform, regardless of where you are,
I'm ready.
let me know.
I'm ready to get
It's
down.
your show. We talk about the things that matter to you. I'll come back.
I'm dancing. I'm dancing. I'm ready. I'm coming.
Thank you, Ernestine Milo. Thank you, Gaia Bridget Gemo. Enjoy Tanzania. Thank you to everybody.
I'm coming back.
I'll come back again
I'm coming back.
next Sunday.
I'm coming. We're coming to get down. I'm coming.
Merci à tout le monde.
We're gonna dance.
Je vous aime,
We're gonna dance.
mais il faut que je parte.
We're gonna dance. We're gonna dance.
Merci à tout le
We're
monde.
gonna get down.
Thank you so
We're
much.
gonna get down.
Bye bye. Love you.
We party